Obsessive-compulsive disorder, OCD, is an anxiety disorder which has as its main characteristics obsessive thoughts and ideas, which are sometimes accompanied by compulsive behaviors and actions, often designed to ward off the obsessive thoughts. There are currently no medical tests which can diagnose OCD. Diagnosis is usually based on information about symptoms as well as clinical observation. Diagnosis of OCD can be made by psychiatrists, clinical psychologists, medical doctors, pediatricians, or by a multidisciplinary team. What causes OCD? There are various theories or explanations for OCD. Psychoanalytical and psychodynamic theorists often see the obsessive thoughts and compulsions as a defense against anxiety or repressed subconscious impulses. Other theorists believe that the symptoms of OCD may be learned through various mechanisms during childhood or adulthood. There is also strong evidence that some people have an inherited tendency to develop OCD and that OCD is linked to problems in brain chemistry, neurotransmission, or receptor functioning. Research suggests, for example, that people with OCD frequently have abnormalities or deficiencies in serotonin levels and that their symptoms improve when this serotonin imbalance is addressed with medication. It is likely that there is no one single explanatory cause for the development of OCD, and a combination of factors may often be responsible. Are psychiatric drugs the only alternative for OCD? Many psychiatrists feel that the only effective treatment for OCD involves medication with psychiatric drugs like clomipramine, Prozac, or other SSRIs, drugs which prevent the uptake of serotonin. While psychiatric drug therapy can often relieve the symptoms of OCD, there are associated risks of side effects as well as an effect on overall health. It is important to realize that treatment with psychiatric drugs is not the only answer. There are also natural alternatives to the psychiatric drugs which will help to balance serotonin levels and therefore reduce or eliminate the symptoms of OCD. Check out these 3 natural alternatives. St. John's wort. St. John's wort has proven to be effective in the treatment of depression and helpful for generalized anxiety disorder and somatoform disorders in research studies. For depression, St. John's wort seemed to work better for mild depression as compared to those with severe symptoms, and poorer for those taking St. John's wort alongside other antidepressants. Valerian root. Valeriana officinalis. This root is often used for anxiety. Studies show that it promotes natural sleep after several weeks of use with no risk of dependence or residual daytime sleepiness. Gotu kola. It has been used for centuries in Ayurvedic and traditional Chinese herbal medicine to alleviate symptoms of depression and anxiety. Get an effective natural treatment to cure OCD developed for people just like you who are tired of struggling with their obsessive-compulsive disorder and want to lead different and better lives. OCD can devastate your life, but it doesn't have to. Take action by clicking the link below. You'd be surprised how well this works.